Hi, hello. Welcome to another episode of Manta Care's Patient from Hell podcast club. My name is Mike Linn, and I'm a patient advocate here at Manta. And I have a special treat today in which I usually host the show, but instead today I'm going to be getting interviewed by Marissa Watland. And so today's episode and all the other episodes of this pod reaction are funded by the Patient-Centered Outcomes Research Institute, or PCORI. And the goal of the collaboration is to bring doctors or researchers onto the Patient from Hell podcast to share about their research so that more of us can learn about it and use it to help in our lives as patients and or care partners. And it kind of gives us the opportunity to chat with members of the cancer community to see how the research and the clinical application of these concepts is put into practice as patients. So today, while I am the guest, we are going to be talking about the Podcast from Hell the Pod from Hell episode number 84, in which Samira Deswani, the founder of Manta Cares, sits down with Dr. Kara Bohan to talk about sleep and insomnia and the role of psychotherapy in cancer treatment.
Awesome. Thanks, Mike. Thank you for having me as your host. I'm very excited to hear all of your take on the episode today that they talk about insomnia in and survivorship. Like, how has that impacted your everyday life, or even maybe when you're going through treatment versus survivorship?
It's funny because insomnia is, a very specific clinical diagnosis that usually people, let's say, who aren't dealing with cancer, we're going to have to seek out. But I can promise you that if you are in the process of being diagnosed with cancer, have been diagnosed, or are going through treatment, you're going to suffer from some version of insomnia, whether you get to the clinical diagnosis or not. Because in terms of stress level, I don't think there's anything crazier than, going through cancer itself. Not to mention, once you are in treatment and you're dealing with some of the physical pain and the side effects from treatment, sleep becomes a really big issue. And it's this weird kind of, cyclical issue, because in order to recover, you need to sleep more. As you don't sleep, you get more stressed out. And I can remember plenty of times in which I was saying to myself, man, I have to get to sleep. And either my brain or my body were just preventing me from doing it. And it can be really, really frustrating. So I think understanding how to better diagnose and treat insomnia within cancer patients is pretty crucial in the entire role of both providers and psychologists and anyone who is a caretaker for cancer patients.
I have never dealt with cancer personally, but it has been impacting me and in and around. But insomnia, yeah, sleep is impacts everyone all the time. I can totally relate to, just your mind being like, you need sleep, get to sleep, and then not being able to do it, and then being more stressed out and more tired on top of that. That sounds so rough to be dealing with. And I feel like, too, that impacts mental health. And maybe you feel like you're doing something wrong even, or something like that. So I know in this episode, they also talk about therapy and cancer and how that interacts. Do you have any experience with that, or trying to seek it out for either the stress of insomnia or the stress of just diagnosis in general?
Oh, absolutely. I mean, when we're talking about the, ways in which a cancer diagnosis can kind of contribute to insomnia or just general sleeplessness, that, like I said, it compounds into just an overwhelming feeling of stress. I know that I physically feel different when I'm dealing with the most stressful portions of a cancer diagnosis or treatment, especially when you're dealing with the unknown. I think that's a pretty ubiquitous thing among cancer patients, is that you're running all of the worst thoughts possible through your head. And it's something that, I went to therapy every single time I was in the process of being diagnosed. And it's hard to relate to therapists because it's just something that is not encountered very often in the world of psychotherapy. And I know that the episode itself mentioned cognitive behavioral therapy, or CBTI, and I was recommended that multiple times during my first diagnosis, because when you start to run yourself through these stress repeating patterns, it almost becomes ingrained as like a checklist of, okay, how do I cope with this? But you don't want to end up putting yourself through that as a coping mechanism, because you're just getting more stressed. So ultimately, I think the role of going to therapy, not only as a baseline for cancer patients, but using CBTI can help you kind of get out of that cycle. It'll help you, dissipate your insomnia. It will help you just sleep normally, at least as well as you can, because the thing that I've learned through 3 diagnoses in 7 years is that you can only take care of so much of the physical part yourself. The treatment works or it doesn't. You are diagnosed correctly and treated correctly or not. There are lots of side effects that you don't have a lot of control over, but the one that you have the most control over is stress and how you manage, that level on a day-to-day basis. And so going to therapy and or subsequently sleeping because you've talked it out, that's a great way to help yourself recover.
Thank you for that insight. And when you're seeking therapy, like you're kind of touching on it, and I know this episode did a bit also, which is, are those people equipped to deal with it? Are they, survivors themselves who are therapists, or kind of what does that landscape look like?
Yeah, it's been a real issue. I know for myself personally, and then as I've done work as a cancer patient advocate, this has been a common theme. People saying that not only are doctors, oncologists, providers, nurses, the medical staff not necessarily always up to speed on the need for psychotherapy as a prescriptive, and or not very sympathetic to people who are saying, hey, this is really affecting my mental health, which is in turn jeopardizing my physical health. But I've had so many instances, literally I've had 5 to 6 therapists that I can think about in the first couple of years of my diagnosis, where I would start to sit down with them and 2 sessions in, I would say this person doesn't really have the best grasp of what I'm going through. And maybe it's also because when I was going to therapy early on in it, I found that this is a strange kind of notion, but I found that therapists who were 40 years older than me, 30, 40 years older than me, were looking at it through the lens of someone who is in an older age, and cancer is kind of built in to the possibilities of someone who is later on in life. But cancer affects, people of all ages. And I think for me, coming to terms with being a young cancer patient, I was 30 when I was diagnosed for the first time. I ended up having to seek out a therapist who not only had an experience with cancer in their family, but similarly, she's around my age. So I could, look at her and say, hey, you can understand how weird this is for me to try and plan out my life as a young adult who's going through cancer, right? Just picture yourself in that situation. And so I think that by finding therapists who have specific experience with cancer, and also, therapists who fit a profile of that person who's going through it, it's not like you need a therapist who is going to be exactly who you are, but having some sort of relativity and basis to it, and at the same time having an oncology staff who knows who to refer to, I think would be extremely helpful.
Having someone who understands it from a standpoint of like, oh, it's not just within your age group, like this is something that's going on, but it is like you have your whole life ahead of you. What do you do next, and how much, almost even maybe more stress that is to try to get through your diagnoses, get into survivorship, and really keep living.
Yeah, I mean, it's almost as stressful as this train going on in the background, so I apologize for that. But it definitely is one of those things where as we progress in understanding how cancer patients, are dealing with their care and benefiting from it, I think we're going to see that any measure we can take to de-stress patients, and especially addressing acute, needs like psychotherapy, like treatment for insomnia, I think it's going to show out in the data long term.
Yeah, I really hope that they identify that and are able to give, better lists to people and resources. I mean, that's what we're doing here right now, right? Like with Manta, is trying to make sure that someone doesn't have to constantly seek out different therapists just to find the one that understands what they're going through, or seek out, organizations and other patient advocacy groups just to find the one that knows what they're going through. So yeah, bridging that gap sounds very important, on top of just everything else that you already are going through and having to deal with when you get your diagnosis.
Yeah, absolutely. And it's one of the things that drew me to Manta in the first place. It's putting the real world application to these needs into place as best as we can, because clearly, given the demand for the products that Manta is creating, people have found this to be an issue. And right now, even though I wouldn't say there's a perfect solution to any of it, creating best fit maps for everyone is going to be a great thing. And I think what, we're doing at Manta is incredibly impactful.
Wow. Well, thank you for your time and talking about that with me, Mike. I look forward to talking to you soon about more Patient from Hell episodes.
Absolutely. It was fun sitting on this side of the table.
Yeah.
All right. Thanks, Marissa.
Thank you.
This podcast, show notes, and newsletter is for general informational purposes only. and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or any materials linked from this blog is at the user's own risk. The opinions of the speakers are their own and do not represent the opinions of organizations they're affiliated with, nor do they reflect the opinions of MantaCares Inc. or MantaCares' sponsors. This episode was supported by an award from the Patient-Centered Outcomes Research Institute.